and welcome back to MAHA Mamas. I'm Tonya.
I'm Jennifer.
And we are on episode 6. We're going to do This Week in MAHA.
Yes.
Because there's a lot.
But first,
yes,
notice we got merch.
So cute.
Got to give a shout out to our girl, Bridget.
Thank you, Bridget.
Who said she loved our show and she wanted to give us some shirts. So I would like you to know that she makes very lovely products, all kinds of stuff, not just shirts.
Right.
So you should definitely check her out on Instagram to see what kind of stuff she's putting out there. It's at m.clarecards. That's her Instagram handle, at m.clarecards. And you can email her orders. They're also linked in her bio on Instagram at m.clarecards@gmail.com. Check her out.
Thank you so much.
Thank you, Bridget. Okay.
All right.
What do we want to start with?
Okay, this one should be pretty quick. Secretary Kennedy has ordered a review on baby formula, which is awesome. I don't know why anybody would be upset over that.
But they are.
Of course they are. They just hate him. But hello, this has not been, like, they haven't done a deep look into the ingredients of baby formula since 1998. I think it's time.
So 1994, GMOs were like invented and started to be put out into the public for consumption. And there is a couple of formula brands whose first ingredient is corn syrup solids, and there's no non-GMO project label on those cans. So since 1998, babies have been fed pure GMO sugar, because that's what corn syrup is. It's corn made into sugar, basically. And on top of like 8 million other ingredients. Yeah. There's one brand that touts that it is closest to breast milk. So we looked up the ingredients.
There's like soy,
the first 4 ingredients were seed oils.
Seed oils.
Yeah.
And lots of soy, folic acid. We'll do an episode on the MTHFR gene mutation.
You shouldn't have synthetic folic acid.
No.
Enriched products.
No.
That's a whole nother rabbit hole.
Right. So I feel like as MAHA Mamas, we're going to recommend breast milk. I have, my youngest is 3.5. I'm still nursing him. I mean, not like all day long, but just like at night or in the morning, or if he's hurt, I don't know, just little things. But yeah, we're going to recommend breast milk all the way. Someone's going to say we're being controversial and shaming moms that can't.
But you can.
You can.
You can. I mean, there are very, very, very few reasons why a mother can't breastfeed. Adoption being one of them, because you didn't birth them.
Right.
But if women who are starving in third world countries, that like you see it in the old National Geographic magazines where their other kids have the swollen bellies and you see their ribs, but they've got a baby on their breast. If they can do it, so can you.
It's true.
And then, they'll say, oh, if it's too emotionally stressful and you just need sleep or you need whatever, you should just formula feed. Well, the body releases something called oxytocin, which is a happy hormone that is like counteracts the postpartum depression hormones. So actually you reduce your risk of postpartum depression by nursing too.
Yes. And I feel like, again, this was another industry that's bought, it has to do with greed. They just want you to put your babies on formula. I was born in the 80s and my mom was told she was having a hard time nursing, which I will say nursing can be extremely hard, like especially your first time. It was really hard with my first baby. It was really hard with her first baby. If you can get through like the first 2 weeks.
That's the hardest. You can do it.
You can do it. The first 2 weeks might be incredibly hard, but like people aren't telling you to check your baby for a tongue tie, check your baby for a lip tie. I had both, unbeknownst to anybody. And my mom had such a hard time nursing me. And I was turning bright red, right? Because I'm a baby, like trying to get milk and working really hard. And the doctors told my mom that I was probably allergic to her breast milk.
I think she was just hungry.
Yeah, I was like a starving, screaming, angry baby, like turning red, right? Like angry and hungry and working hard. And they told her, oh gosh, you must be allergic to your breast milk. Here's formula. And my mom did it. And I love you, Mom. I get that you were told that. But like, it's probably still happening today. Like doctors are just very quick to say, oh, if there's any suffering at all, here's formula.
Well, and my mother was told, I was born in the later 70s and I was the youngest of her 7 kids. And she tried every time, but they didn't have support then. And she was told, well, actually it's fine because formula is more healthy than breast milk. again,
Oh my gosh.
like we've talked about, you cannot improve on God's design.
Right.
There are things in breast milk that are like specifically designed for your baby too.
Right.
And
Yeah.
and the milk will make what your baby's lacking.
Like as your baby nurses, that your body like identifies like if they're fighting a virus or what, and they can create more antibodies, and just it's this incredible God's design. I know.
Yes.
It's so cool. So that's what of course we're going to recommend. But I'm super happy Secretary Kennedy is, ordering this review. There's also like goat's milk, or find another mom that's breastfeeding, take donated milk. Like
if you have a supply issue, or you do have some sort of something that is truly preventing you from nursing, don't go with this. I mean, I know they're improving it, but I promise you it's still not going to be awesome. Like there's organic formulas out there, but you can make your own with raw cow's milk and goat's milk that is much better and gentler on your baby than that garbage that's in a can.
Right. And there are a lot of donor moms too. So there's so much support. Go find it.
Yep. 100%.
Okay. So the main thing this week that I want to talk about is the ACIP. Maybe you have heard that they are gone.
What are they?
Bye.
They are the Advisory Committee on Immunization Practices. It's a subset of the CDC.
Right. And so they are like your medical public health experts, right? And they recommend the vaccines that get put on the schedule, like the CDC schedule in the United States, which is not the same schedule in other countries. I just don't think people have any idea, which I don't. I kind of have a story about that later. But these people are in charge. And I have been watching these meetings since probably 2018, 2017, 2018, 2019, somewhere in there, like before COVID, because there's opportunity for public comment. And so people have always tried to rally people to go in and speak up. And these people on the board, on this committee, are horrific. I don't know how they sleep at night. There's so much conflict of interest, so much corruption. It's a revolving door. Everybody's making money. There's just a lot of greed and evil. There's just no morals, no integrity.
But people are losing their minds because they feel like...
Because the media is telling them to.
I was on X the other day.
Yes.
And there was a gal. Okay, so when he put this on X, he put this really, Secretary Kennedy put this really long post.
Yeah.
And with like millions of citations, right? And so then I went into the comments section, which is like the Wild West. And there was a lady named Tammy. And she just represents like everybody. You know what I mean? Like she just represents everybody who doesn't want to do the research, just wants to listen to sound bites, just wants to listen to Secretary Kennedy's crazy family members and the Democrats that questioned him on Capitol Hill. And just the media, like stark raving mad, he's gonna kill everybody. Okay.
I'm trying to find it.
Yeah. So Tammy like made sure she used all capital letters so that we knew she was yelling. And she said, I'm just gonna paraphrase because like I feel like Tammy's the new Karen.
Yes.
Tammy's the new Karen.
Sorry, Tammy's.
Like how did it even become Karen? Because I've met way more Tammys and Janices than I have Karens. You know what I'm saying?
Yes.
But all caps, she wrote, "This is insane. Like everybody's gonna die, and your father would be rolling over in his grave. Shame on you."
Oh my goodness.
And then like there were other comments. Well, Tammy, his dad's dead because he asked questions like Secretary Kennedy has. And he, would probably be actually very proud of his son. I don't know what happened to the rest of his 10 siblings, but
so we have a video of a Tammy.
Yeah.
Igniting an uproar now after removing every member of the CDC's Vaccine Advisory Board. We first reported on this last night here, and tonight now the protesters at the CDC telling our reporter the brain trust is gone, the people we trust on vaccines are gone. Steve Osunsami at the CDC tonight.
Outside the CDC today, they're fed up.
The brain trust is gone. The people that we trust
to give us the right information, the scientific explanation, are going to be gone. And RFK Jr. is going to be the one calling the shots.
They're upset with the nation's health secretary.
Okay, so do you think that lady could name a single person that was sitting on that board?
No.
I guarantee you she doesn't even know who the brain trust is. What is brain
What
trust?
is
Is that a new
the brain
buzzword,
trust?
like neurodivergent?
Well, it's like the brain rot, kids.
Right.
Oh. Yeah. So this is
everybody's protesting. They're protesting everything right now.
They are. We could talk about that too. But this is the whole group think. This is like what people want you to believe, that he's wiped out this whole committee
of like just the brain, like the smartest people in the world.
Yeah. And so
who know all the things.
Right. But now we have a video of these people, and this is how they vote to add another vaccine to the schedule. Let's take a look.
This is really good.
Is there any comment on using this vaccine at the same time with other adjuvanted vaccines?
We have no data to make a recommendation one way or the other.
So just to sort of put this in context of other vaccines, whilst preclinical studies were not done using these vaccines simultaneously, our general approach to immunizations is that they can be given at the same time in different limbs.
Dr. Hunter?
Are multiple adjuvanted vaccines used in Europe or other markets?
Dr. Ward, do you want to comment?
Not to my knowledge.
Oh, they don't?
Okay. I think unless there's any further discussion, we will take a vote on this recommendation.
I want to remind everyone to please check your voting machine thing, and voting is open.
Thank you very much. So the voting is completed, and it is unanimous to support this recommendation.
That's the brain trust? Is that what Tammy called? I don't know if that lady's name is Tammy. She just acted like Tammy on that. So I'm just assuming it's either Tammy, Karen, or Janice.
Oh my
God. I just can't, like, that's who he fired. Okay. That's who he got rid of.
So I don't know if you understood that. That video started with them saying they have no data on this, which is true. So they want to add this vaccine to the schedule, and somebody asked, "How do you have any data to show how it would react or whatever with the other vaccines that are given at the same time?
Just put it in the other limb."
Yeah, or like even when you add a vaccine to the schedule. So obviously, what Kennedy has been saying this week is that there's no. I'm sure you've heard the whole double-blind placebo study. Maybe we need to talk about that. But so that's true about each and every vaccine. And I wish I had maybe I'll look up his quote that he mentioned earlier. I'll look that up, save that, hold that thought.
Okay.
But so he's saying this about each specific vaccine, which is 100% true. But then there's also no safety studies on what happens when you give them all, like this whole schedule, right? Did you find it?
Oh, I found Tammy's.
Oh, she found Tammy. Okay, so there's none of those double-blind placebo studies for each vaccine, but then there's also no studies on what happens if we give them all. And I don't know if you know, but the number of vaccines on the U.S. schedule was 72 and counting. Kennedy just said in some states it's up to 96. And I think that's with the COVID vaccines too. I haven't checked it lately, but last time I did it was I guess last time I gave a talk on this, it was at 72, and people don't know that. And they've done no studies on what happens when you give these all together within, 18 years of life, or when you keep adding them, because there's a million vaccines coming down the pipeline, because these are immunity-free products and people just want to keep adding to the schedule.
Because it's a blank check.
Right.
Honestly.
Yes.
We're not going to get sued. So we're just going to keep making more, even though we don't really need to worry about this
so
minuscule little disease.
Yes, So they just keep adding them. And so what that person was saying was, well, does anything go to be concerned about by adding all these extra adjuvants? And the lady was just like, we don't have any studies data on that. And then the other lady was like, just give it in a different limb. Just give it in another part of your body.
As
Like,
if this arm isn't attached to the same central nervous system as
you
this
have
arm.
immune system. You have one
Yeah.
immune system. You're just going to come at it from all different angles, and
That'll be fine. Everything's fine. But this is the brain trust. And they're like, now he's just going to hire a bunch of people that aren't competent.
Right.
Well, I'm going to go through who he did hire.
Okay. And they just said, okay, let's go ahead and just take a vote. And did you see 100%? 100% vote that voted yes, and just let it get put on the schedule.
But as long as a couple guys ask like 1 or 2 questions before they vote, it's fine.
They seem like
it's
their
fine.
concerns are. And also, like public comment, people who do go and speak on what's happened to their child after vaccines, and a lot of adverse events and deaths. These people, you're just swept under a rug. They don't care. They don't care. They're going to do it anyway.
Mhm.
You're going to be part of the. I had another video. I should show that another time. But you're going to be part of the post-marketing surveillance. Like, you are part of that.
So we got rid of the brains. You saw the circus act that we just showed you.
Mhm.
And then he said, 19 hours ago, he put on X, on Monday, I took a major step towards restoring public trust in vaccines by reconstituting the ACIP. I retired 17 of the members of the committee, and I'm now repopulating ACIP with 8 new members. So he cut it down, which is great.
I think he's going to keep adding more.
So here's just the street cred of the people that he added. And I just want to say, like, when I've gotten into arguments with people about pharmaceuticals, et cetera, well, you're not a doctor. Well, I can guarantee you I've done more research on immunizations and nutrition than any doctor gets in medical school.
Mhm.
But I don't have the letters behind my name, so my research is incredible for whatever reason.
Right.
And then, you do have doctors come out and say stuff, like Peter McCullough, who's a cardiologist. So then it's like, well, he can't talk about that because he's a heart doctor. Guess what, guys?
Vaccines
they all
affect
went to
the
the
heart,
same
yeah.
4-year medical school before he went and did another 4 years.
Right.
So they all have the same basic learning on pharmaceuticals and immunizations, which is minuscule.
Mhm.
But they went to school that literally taught them how to research. So you don't think they can figure this stuff out on their
Right.
own? It's just
If
ridiculous.
you break free of that group thing, you're
and that
fine.
only certain people can have a voice on something
Right.
because of their credentials.
Mm.
So we've got Joseph R. Hiblin, MD, is a psychiatrist and neuroscientist with a career in clinical research, public health policy, and federal service. And it's a really long thing. I'm not going to read you that. But Martin Kuhldorff, MD, PhD, is a biostatistician and epidemiologist, formerly at Harvard Medical School, and a leading expert in vaccine safety and infectious disease surveillance. He has served on the Food and Drug Administration's Drug Safety and Risk Management Advisory Committee and the CDC's Vaccine Safety Subgroup. But I guess
I'm
because
sure Tammy would have loved him, last week.
yeah, but he
because-
criticized vaccines or had questions, he's automatically discredited.
Get out of here.
Russ F. Levi, PhD, is the professor of operations management at the MIT Sloan School of Management and a leading expert in healthcare analytics, risk management, and vaccine safety. He served as faculty director of MIT Sloan Food Supply Chain Analytics and Sensing Initiative, co-led the Leaders for Global Operations program. Robert W. Malone, MD, he might sound familiar to a lot of you guys. He actually helped develop the mRNA vaccine and then had massive remorse after that and sounded the alarm bells. He's a physician scientist and biochemist known for his early contributions to mRNA vaccine technology. He conducted foundational research in the late 80s on lipid-mediated mRNA delivery, which laid the groundwork for later developments in mRNA-based therapeutics. Cody Meissner, MD, is a professor of pediatrics at the Geisel School of Medicine at Dartmouth and a nationally recognized expert in pediatric infectious diseases and vaccine policy. He served as a section chief of pediatric infectious disease at Dartmouth Hitchcock Medical Center and has held advisory roles with both the Centers for Disease Control and Prevention and the Food and Drug Administration.
Okay.
James Pagano, MD, is a board-certified emergency medicine physician with over 40 years of clinical experience following residency at UCLA. He's worked in very diverse emergency settings from level 1 trauma centers to small community hospitals. Vicki Pebsworth, OP, PhD, RN, earned a doctorate in public health and nursing from the University of Michigan. She has worked in the healthcare field for more than 45 years, serving in various capacities, including critical care nurse, healthcare administrator, health policy analyst, and research scientist with a focus on public health policy, bioethics, and vaccine safety.
Awesome.
Michael A. Ross, MD, is a clinical professor of obstetrics and gynecology at George Washington University and a Virginia Commonwealth University. Maybe we can talk about pumping women full of vaccines when they're pregnant.
Yeah, which that's my story later.
With career spanning clinical medicine research and public health, he has served on the CDC's Advisory Committee for the Prevention of Breast and Cervical Cancer. That's the A team right there, guys. No brains there. I don't have no brain trust.
Right. People are so upset. But like, people are so upset because they're being told this by the news, like by the media, by whatever politicians that are saying Kennedy's ruining everything. Like, I feel like I'm watching a movie and he's like the protagonist and we should all be like, yes, like, you know, he has so much to fight
He's like
for.
Captain America.
He is on your side. He is on your team. Like, he is fighting for us and the future of our kids. Like, I don't know why people don't see that. Like, it's just
because
awful.
People have been spoon-fed their entire life what they are to think and how to think.
Yes.
And that was strategic in our public schools and everything else.
Yeah.
So it's just, let me just regurgitate the talking points like a raving mad lunatic instead of actually hearing the facts.
I know. I feel like if he went into anybody's living room and talked with the family, they would just be blown away at how incredible he is. But instead it's these idiots on the news. Oh my gosh. Okay, so here's what he said in a news conference a couple days ago. He said a compliant child must take between 69 and 92 vaccines. Sorry, I got that number wrong earlier. To stay in school in some states. And not one of them has been safety tested in a pre-licensing placebo-controlled trial. And that is just malpractice. So the people who are in charge of that are now gone. Thank God.
Mm-hmm.
I mean, again, I've been watching these meetings for years, and it's like, it's just, they just lie repeatedly under oath. They have no morals. Like I said, they have no integrity. They could care less. If there's injuries or deaths, swept under the rug, put it on the schedule. It's so frustrating. It feels like nobody's listening. It's sad and it's wrong. And Kennedy is here and I'm so grateful. And I just wish people would understand how, like, where we're at in life right now. This is just like a dream come true right now. So with that, please spread the word that this is a good thing. I don't know why people are freaking out, but whatever.
And we want to, I just want to take a minute to say, light up our comment section. We've gotten so much feedback from local followers, like how much they're loving our show. But we want to reach more people, and we can't do that without your comments and your interaction. So please subscribe, share on your own social medias.
Totally.
And we want to engage with you. We want to hear what you want to hear about. But please, if you like our content, engage with us, because that will help us reach so many more people.
Yes, totally. Okay, so I'm going to end with this story. I spoke to kind of elderly-ish man, maybe 70s. This past week, actually, we were talking about vaccines. It came up somehow. And he, the first thing he told me, I said, well, what do you think? And he goes, I don't know about this secretary guy, vaccines save lives. That's all he could tell me. It was just hammered in his head, vaccines save lives. And I said, okay. I said, how many, it was just a really nice conversation. It's never heated or anything. And I just said, well, how many vaccines did you get when you were a kid? And he was like, oh, he's like, we had 3 or 4. And I said, okay, do you know what we're at now? Do you know what the schedule's at now for the childhood vaccination schedule in the United States of America? And he was like, no, what's it at? And I said, it's over 72. That's the number I told him to. I said, it's over 72. And his mouth dropped. And he was like, what? And so I know that he has good intentions, and he was taught that vaccines are safe and effective and they save lives. But people just aren't aware. And so the first thing he said, well, the one thing I know is that you don't give them to pregnant women. You don't give them to pregnant ladies. That was one thing that my dad taught me. And his dad apparently worked for like NIH and did all this stuff with vaccines in other countries. And so we were actually having this really incredible conversation. And he just said, you don't give them to pregnant women. And I said, oh,
well, they do.
They do. And that's what they recommend. And this whole childhood schedule starts in the womb. Moms get pregnant and they just want to start vaccinating and
DTaP and flu shot.
And unfortunately, we lose a lot of babies that way. And you've got to start. Maybe we'll talk about that someday. But yeah, he just had no idea. And so I said, you're right. Obviously, I'm not going to recommend giving them pregnant women either. And so, because I didn't tell him, like, I wasn't like, I'm totally against these. We were just kind of hearing each other out. And I said, that's good. I wouldn't give them to pregnant women either. So anyway, moral of the story, like, I think the older generation might be telling, like, our grandparents might be telling us having babies now, like, we got the shots, you get the shots. Like, we got the shots, get the shots. They have no idea. We are not the same. Okay. They had 3 or 4. We're at 72 and counting, apparently.
Well, and they've
92.
added ingredients that probably weren't in the ones that were given back in the 50s, 60s, 70s, like peanut oil. And, like now we have all these peanut allergies and stuff like that.
Yes, because the reason is the adjuvants. This is, people have so much to learn.
Well, and I wanted to bring up one story real quick too that reminded me, both the ACIP clowns saying, we can just do them all at once, just pick an arm, and then the pregnant woman. So I talked to a mom, she wasn't pregnant at the time, but of many children, like more than 6. And she had been with the same OBGYN for all of those babies. And she shared with me that she got a DTaP with every pregnancy except for her last one because she was kind of starting to research. And I go, wait a minute. And these kids are like range anywhere from 1.5 years to 2 years apart. And I said, so you've had this many babies in, like 15 years, whatever, 13 years, and you've gotten a DTaP with every single one.
Because that's what the OB recommends.
And the same OB who has looking at her same file. But when you look at a DTaP vaccine, what do they recommend them, one every 12 years or something crazy like that?
Like
she was getting them every pregnancy. So every 1.5 years. So the OB is hyper focused on somehow giving that baby the immunity, but not like totally discounting the mother and her toxic threshold. Like that's contraindicated to have that specific vaccine that many times in that short of a span.
Right.
So what we're doing is we're discounting like even what the own recommendations on the vaccine are based on the scenario. And so I bet he didn't even think about it. I bet that doctor didn't even think about it. But if you sat him down and said, because, he's used to have women who have 2 kids probably.
Right.
If you sat him down and said, you just gave that mother of 6 and that mother of 9 and that mother of 7 a DTaP every other year. Did you think about the contraindication of that? And he probably wouldn't have even thought about it.
Do you know the ingredients in that? Do you know what you are doing to that woman? Like, no. And they don't think about it because they just it's just the paycheck. It's just like however many % of my pregnant moms are fully vaccinated, or same with pediatricians, whatever % of my, patients are up to date. Like they get bonuses.
They do.
Yeah, we can go over
from
that
insurance companies and pharmaceutical companies. So it's a cash cow. Like I heard once that pediatricians were the lowest on the totem pole as far as salaries. So they get paid the least out of all the doctors. So the vaccine schedule is literally their cash cow because of all the bonuses that come with having a full, like a 75 or 90% vaccinated clinic or whatever it is. They go in and they look at their files. They see how many of the children are fully vaccinated, and then they cut them checks.
Which is why they will now kick children out of practices. Like because
you're not making them any money.
Yeah. If a family says, oh, we're not going to vaccinate, or even we're not going to go by the schedule perfectly, we're going to space them out or do our own thing, they will very much be like, okay, then you can't come here because their percentage just dropped. So,
but you can always find one. I mean, we're fortunate we have a few in our town that respect and actually acknowledge and admit to the dangers of that whole industry. So there are places that you can go if you're in a different town and you're trying to find a doctor and you've been kicked out or whatever. Get in a natural health Facebook group or something. There's always a way to find some that respect your wishes.
100%.
So,
Totally.
okay.
Is that it?
I think that's it.
Okay. Well, thanks for listening. Remember, go like and share and do all that.
Yes.
Please. And even
Yes.
if you're a Tammy, like, let's go. Let's hear what you have to say. Why do you think the way you think? Like, I want to know how you came to that conclusion.
I want to know if Tammy knew any of the doctors on ACIP's
Oh
board.
my goodness.
If she could even name them, because I bet she couldn't.
Oh, okay. Well, that's it. Thanks for listening to the MAHA Mamas podcast, where we hope to inspire you to reclaim your health by trusting in God's design.
But remember, God helps those who help themselves. So go get after it.
Go.